One of the big worries over the past few weeks has been on the public health emergency. Is the Biden administration going to extend this? Will the Health and Human Services Department, will they push to see this extended? Well, we have news on that because low income benefits are not ending yet. They're not. 2 days ago, we learned that the Biden administration and Xavier Becerra, they announced that they are going to be extending the public health emergency. Now, this is really good news because this is going to be another 90-day extension. This is exactly what we need, which means that benefits for the public health emergency, they won't end until possibly Tuesday, April 11th, 2023. But as Becerra has also said, this will likely be the last time we see this extension. Again, that's a problem, but it might not be a big issue moving forward. Now, I'm going to address what low-income benefits are still going to be, which ones we still have, what we are likely going to be moving away from very soon. But if you are currently getting Medicare, if you're on Medicaid, if you are currently getting SNAP benefits, this is a very important update that you need to be well aware of, all right? So make sure you watch this entire video. Now, let's address what the spokesperson for Health and Human Services just said the other day, because they said, and I quote, "The COVID-19 public health emergency remains in effect, and as HHS committed to earlier, we will provide a 60-day notice to states before any possible termination or expiration." So, what this means is that the public health emergency, when this ends, and yes, and stimulus ends as well, and yes, I did say when, not if. When this does end, we will have confirmation 60 days before, or at least 60 days earlier. So this means by Saturday, February 10th, we would have a confirmation that, yep, this is it. This is the last time we are going to extend the public health emergency. Now, we've talked about this before, but the importance of this time of the year is what makes health experts agree that we can finally lift the public health emergency and move on. Because by April, and this is why April is such a significant piece to the puzzle, we are going to see COVID cases drop significantly. We're going to see flu cases will be down. RSV will be much less of a factor, right? And the overall health of the American people should be greatly improved. That's what we're hearing. So what does this mean for benefits to lower income Americans? Well, here's what I can tell you. Benefits as of right now are staying intact. However, states are slowly moving away from them. They want to taper off. And the reason why states want to taper off is because if they don't taper off and they slowly remove benefits, what's going to happen is people could be getting 100% health insurance. They could be getting a massive amount of nutrition assistance. And if they just take everything away all at once, people could really struggle. So they're going to slowly start removing benefits. Now, here's what's happening. The emergency declaration has had a huge impact on lower income Americans. We have seen it protect public health insurance coverage for millions of people. The emergency declaration has provided hospitals with even greater flexibility in dealing with patient surges and even the expansion of telehealth. That was vital, especially over the past couple of years. Now, once this is over, hospitals are going to lose a lot of their flexibility, but it's not going to stop there. Even pharmacies are going to lose their flexibility as well, because pharmacies have had an increased role in administering vaccines during this tough time. But again, a lot of that's going to end. Once this public health emergency ends, we will see millions of Americans lose health insurance coverage under Medicaid. Just last month, and I'll give you an example, Congress began telling states that they can start kicking people off of Medicaid if they no longer qualify. But that's not going to start until April, okay? So, obviously, healthcare is a huge factor when it comes to public health and this public health emergency ending. But nutrition is a big one. Nutrition is one that is going to just devastate millions of low-income households. And now let me explain why. So if you are on Social Security and you are getting SNAP benefits, you are likely going to be impacted. If you are a lower income household, unfortunately, you're going to be impacted. And here's why. Currently, SNAP beneficiaries are getting a 12.5% cost of living adjustment in 2023. This is a pretty big increase, but it is not as big in many cases as receiving the maximum benefit on top of a $95 per month increase as a result of the emergency allotment. Yeah, that emergency allotment, that is one of the things that has been implemented by 33 states as of this month, as of January. Okay, let me show you the chart right here. So these are the states right here that are currently offering the emergency allotment through January 2023. The problem though is, and I don't know if you'll be able to see it. Yeah, there it is. As of right now, we're January 13th. These are the 6 states that are offering emergency allotment. Okay, these are the 6 states as of January 13th. So you can see it's a pretty big decrease so far. But I just want to be very clear on something. Millions of lower income households are going to lose a good amount of nutrition assistance moving forward. Okay, but that's not all. One of the provisions of the public health emergency is that states were giving beneficiaries the maximum benefits based on household size. Okay, but that's going to stop once the public health emergency expires. Meaning, and let me just give you an example here. A family of 3 could have been eligible or could be eligible right now for around $740 a month as the maximum benefit. But once the maximum benefit goes away and the family loses the $95 per month emergency allotment, they will go from $740 down to closer to about $335 a month. So you're going to lose almost half of your benefits simply because the public health emergency expires. Now, there's even been reports that are saying that seniors are going to get currently are getting about $250 a month, so less than $10 a day. They'll be reverted back to their minimum amounts, about $20 to $40 per month. And again, this is going to make basic nutrition unaffordable and almost impossible to just to keep people healthy and fed moving forward. So my expectation is we're going to see Congress come out, or the Biden administration come out with additional resources to help these individuals. I don't know when. I don't know if it's going to happen sooner or if it's going to happen closer to April, or if we don't see anything at all. But my guess is something is going to have to happen, because this is going to pretty much put millions of people under that umbrella of not having any nutrition, not having affordable meals. Again, that is a huge, huge issue. So as we get more information as to what is going on here, how we are going to be impacted, when this emergency is actually going to be lifted, I promise I will fill you in on all the latest news and updates. Again, thank you guys for watching. Have a wonderful rest of your day. Consider subscribing, and I'll see you guys on the next one.